Illinois will now be using Medicaid dollars to address the root causes of what officials call health inequalities. The federal government recently approved a waiver giving the state more flexibility in how it spends Medicaid dollars, allowing it to experiment with matching federal money. Governor Pritzker says the state will use the money to help struggling people to find housing, help them with food insecurity, unemployment, violence prevention, and more.
When these basic needs like housing and nutrition go unmet, individuals are 2.5 times more likely to have poor physical health, 5 times more likely to have mental health challenges, and twice as likely to report higher health care utilization.
The Illinois State Health Care Department will administer the programs.